Getting to the root cause is always the key to true longevity, quality of life health benefits because the quick fixes, they just cover things up and the underlying condition is still there and it's
Yep.
going to manifest into something eventually. Yeah.
Or you're going to have to
Yeah.
rely on, a Band-Aid medication for the rest of your life.
In healthcare, they, separate things so much and just chase each individual symptom, whereas our body is all connected. Chiropractic truly changed my life.
Hello, everybody. Welcome back to another episode of She's in Sync. Today, I am joined by Dr. Heather Walker, and she is a chiropractor whose own healing journey from chronic illness, which we'll be getting into, to a vibrant health inspired her to dedicate her career to helping others. She has a doctorate from Life University, advanced pediatric certifications, and over 20 years of practice at her and her husband's business, Advanced Wellness Center here in Upper Arlington, Ohio. And Dr. Heather combines her passion for chiropractic care and nutrition to transform lives and support families in our community. So, Dr. Heather, welcome to the show.
Oh, thank you so much, Taylor. I really appreciate having me on.
Yes, you're so welcome. So, I want to start off by just sharing my own personal how, because I am a patient of yours, a client of
Yeah,
yours.
yeah.
And I was like trying to think how I found you guys. I think it's because we kind of, and you said this when we first connected, we kind of run in the same wellness circles in
Yes.
Columbus. But I was at a point where just in my own health journey, I was kind of putting my health on the back burner and really putting my business first. And I was starting to feel that physically, mentally. And so I just had this moment where I was like, okay, I need to realign and practice what I preach. And part of that was getting back into chiropractor care because I have a history of just with my job, I'm a very active person, but I'm sitting at my desk a lot of the times doing virtual work. And I was starting to feel that in my lower back, my ribs, and just some stickiness overall. And one of the big things I learned from you and what I love and will be diving into is your emphasis on nervous system, which I was not expecting when I came into your care. I was thinking more physical wellness. But that has been such a great addition to my mental health routine too, just focusing on the nervous system and how physical adjustments can help with that. So that's how I connected with you is I was just, that was a promise I made to myself was to recommit to my own health and started seeing you. And I've been, going ever since I think June and it's now October, which is crazy.
Right, right. Yes.
So tell us a little bit about your own personal like journey in hormone healing. Because when I initially connected with you, it was more of a professional connection of like, hey, mutual client referrals. We do have a very similar clientele and holistic wellness perspective and approach. And then I was like, oh my gosh, this is great. Like, I'm going to become a client. So, but tell us a little bit more about your hormone healing journey and just your health journey in general.
So, I was not a very healthy kid, to be honest. I had lots of sinus infections and, just asthma, all these things kind of just kept escalating when I was younger. That's how chiropractic truly changed my life because I started seeing a chiropractor when I was about 16. And before I knew it, I stopped getting sinus infections. I stopped needing an inhaler. I've never needed one again. And that was, after 2 months of getting adjusted, I no longer had asthma. So all these things in my life changed. I was, prior to that, I, had started my period, like most girls and I was about 13 and they were very painful. And I noticed actually after I would get adjusted, my cramps were better. It was always like an immediate, I was like, oh my goodness, this is wild. But there were underlying things obviously that I went through the normal routine, unfortunately. My parents were not holistic. We didn't know about other things. And, the answer that you always get, the one option was, oh, well, my OB said, let's put you on birth control. If, your periods are erratic or painful, that's what we do. So that's what I did at like 14, and there was certainly no
Mhm.
need for it. But I was on that for, all my high school years and into college. I did my undergrad at OSU, and then it wasn't until we moved to Atlanta for grad school. So I was, in my early 20s, and they had changed my pill a few times, and I started noticing like I had gained weight. I started putting on weight. I started like noticing I was depressed. I didn't know that's what it was at the time, but I was like, oh, I had a hard time getting up for my classes. And that was not me. That was not my personality at all. I had never felt that way. Um, so I noticed just this, like, I was starting to get depressed. And at the time I was in grad school. So I was learning, I was in chiropractic college. So I'm learning about, there's a lot of nutrition. There's a lot of nutrition as part of your, doctorate, which I love. There's like 300 credit hours of nutrition. It's incredible. So during that time, I was learning about birth control and how it affects your body. And it was a real wake up call for me because I was like, oh my gosh, that is what's happening. Like, because of course, then they recommended antidepressants, which I never started. But I realized that snowball effect, and I was like, that's it. I'm going off. I'm going off of the birth control. Um, but at the time, I didn't know how to solve the hormone imbalance that was really the underlying cause the whole time. So I had changed a lot of my diet just because of what I was learning, and, was eating certainly cleaner and, less things that had hormones, and I was, dairy and all these different things that I was learning at the time. Um, Fast forward, several years, I had not been on birth control. We had started our practice. We moved back to Ohio because our family is all around here. Started our practice, and that's stressful, as you know, owning your own business. It was very stressful, and we that was definitely my primary focus for several years, and then about 4 years into practice, we were ready to have a family. And I was, what I hadn't really given thought to was the fact that I had not been on birth control. My husband, we had been married all through grad school, and there was no accidental pregnancies, and several years had gone by. And then it was like, okay, we're going to start trying. Like, we're actually going to start trying to get pregnant. And years had gone by, and I wasn't getting pregnant. Then had multiple miscarriages, which I think a lot of women go through and don't talk about. And I feel like this part of the journey for me, at the time I was, a doctor, I was seeing a lot of patients, and it was hard to go through that personally and seeing patients. But it was also, I feel like this journey really led me, but there was a reason for it. And I think it's helped me help a lot of other women. And we talked about, miscarriages a lot more, and they were able to open up about it, and just the emotional aspect and the physical aspect of it. There's so many components to it. Um, and my OB, who was, a lovely person, and she was very sweet. However, there was never any answers. It was just, oh, this happens, and, I'm sorry, but we'll just, there's Clomid, there's, let's try this medication, or, let's just keep trying for next month. And after that, it happened a couple of times. And one of them was, later into my pregnancy, which was very difficult, to go through. I had to just, step back and go, okay, that this is not, my body is telling me this for a reason. There's a reason that it's ending these pregnancies, or I'm also having a hard time getting pregnant. So I very much took it into my own hands, and I decided to have a laparoscopic surgery done just to see what was going on, because they had done ultrasounds, they had done internal ultrasounds, and I had not gotten any answers. I had done some, of course, like blood work labs, but it didn't really tell me a lot. And then in the laparoscopic surgery, they found that I had PCOS and endometriosis, pretty severe case of endometriosis, which they said, is incurable. This is just how it's going to be, and surgery is your best option. And we should, you know, cut some of the, portions of the ovaries out. Anyway, it was not an option for me. So I had enough background in nutrition, in, supplements, and certainly with chiropractic and holistic um, perspective on things that I just said, okay, well, thank you, but that's not the direction I'm going to go right now. And I really just delved in and advocated for myself, really studying, taking a lot of courses on hormones and nutritional formulas and herbs and acupuncture and so many things that I took on at the time. Also, diet. I went gluten free and dairy free and sugar free. I wasn't a lot of fun for a little while, but it was completely worth it because I felt incredible. My periods completely shifted. They were starting without me even noticing it. I wasn't in pain for a week beforehand. I didn't, have all these irritability and all these, difficult signs coming on. And then I just started to feel all these changes in my body um, and I gave that, I was very strict about it. I'll be honest. I was very strict for 10 solid months, diet wise. And because I knew I had some healing to do, and I really just focused. I also shifted my focus because trying to get pregnant it can become very stressful and very frustrating. And then I think that adds to the whole scenario. So I had to take a step back from that. My husband and I really just focused on healing and becoming healthier and not worrying about tracking constantly everything. And because then that gets really daunting too. So we really just took a very different shift as far as our focus and just stepped back from it and said, okay, this is just healing time. And that's what I did. I didn't track things. I just really was focusing on what I could eat and what I could take. And I did take a lot of supplements. I did saliva hormone testing. It wasn't, we do Dutch testing now, but it was a different, one then, but it was similar. It was, saliva and urine, and it just tells you so much more. So went down that path, and then I actually went back in. I wanted to know what the difference was internally. So I actually had them do another laparoscopic through the same doctor, and my endometriosis was 87% gone,
Wow.
which they said was impossible, and I no longer had PCOS. Um, and it was about 6 months later, I naturally got pregnant with our daughter. And we have three beautiful children now, and they're healthy and vibrant. And I didn't have to take anything to have them, got to have three natural births. And I am so grateful. There was a lot of prayer over those years as well that I have to mention because my faith was a big part of that journey. But my great grandmother had always told me, you also have to put legs to your prayers, and I definitely did that. My husband and I, we that's part of the learning, right? Like that's doing it, taking the supplements, doing the lifestyle changes, and I did acupuncture and chiropractic care. I increased my adjustments, and I did, massage, and there were, herbs, and there were a lot of different factors, but I know I wouldn't be where I am today without that journey. And also, I think just being able to share that with others has been such an incredible part of that process.
Thank you so much for sharing all of that because, it sounds very similar to my journey and a lot of women I work with of just like really having to advocate for yourself. And unfortunately, kind of figuring it out on your own or finding someone who can't. You and I at least have the backgrounds in health and wellness to, find the research and trial and error on ourselves effectively or safely rather. But, the average person does not. And so it speaks to why it's important to find someone like you and myself to help them navigate through that
Yeah.
journey. Because unfortunately, most of the time when you're going into your doctor's appointment, it's going to be a, well, take this medication, whether it's birth control, Clomid, whatever. And they skip over a lot of really important questions of like, how's your diet? How are things structurally? Like what's actually going on?
Yes. Yes.
How has your own journey shaped how you practice now in your business and how you do chiropractic differently? Do you feel like it would have been, do you feel like it's different than if you wouldn't have gone through that journey? I know, or would you have practiced the same way, do you think?
Um, our practice, our focus was always very holistic. I think that was just that came natural to us. Nutrition was definitely something that I always incorporated in our practice and the way we spoke to our patients. And it was always about lifestyle. But I definitely would say the the depth that I went into hormones and certainly that education, of course, impacted. And I think just the journey that my husband and I went through gave us a different level of compassion and understanding for patients that are going through things like that you just can't have without the experience sometimes.
Hmm.
Um, and of course, that impacted, our ability, I think, to connect with people on a different level, especially when it comes to try and have a family or, just the things that they're going through, and particularly women with hormone imbalances, and I think just the answers that they get from, the regular healthcare system, and I would definitely say it impacted that part of our ability to connect with people on a different level.
Yeah. So let's talk about that, how advanced wellness, your business, your and your husband's business is different than
Yes.
typical chiropractor places. Because
Yeah.
you've been my third chiropractor that I've had. And I would say the first one was very much, it was like a chain, insurance based, like you come in, you get cracked, you leave. It's kind of the same thing over and over again. And then I would say the second chiropractor I went to was a little bit in between, where they were, a little bit more on the holistic side, but not as personalized, I think, as what you guys do. And they don't offer the complementary services that I want to talk to, like the infrared sauna, like the PEMF, like the um, massage therapy and piezo, which I personally have been doing. So I mean, I kind of just like said a lot, but tell us a little bit how
Yes,
you guys are different from, like, let's start with your technique, because you're not the chiropractor that's going to come in and like put your hands on and like crack people. It's very different, which I find fascinating.
it is. Yes. So from the foundation of our practice, I would say is different, which is the technique. All of our doctors are certified in the activator technique. So we use an instrument to adjust. It's extremely gentle. It's very safe. It's much more modern style of care, and it's much more specific, which is really what I love about it. So we use an analysis, as you know, with each patient. So it's your body telling us where you need adjusted rather than us just palpating and, you know,
Forcing
feeling
it.
where there's yes, and then forcing an adjustment to happen. So when you don't have to involve the soft tissue, the instrument works at the speed of the nervous system. So we don't, there's no twisting, there's no cracking, and it actually allows your body to make the change instead of us forcing the body to do something. Which is very different because then the body tends to hold the adjustments better. It holds them longer because it's your body making the difference and it's your body making the change and the shift and allowing that nervous system to start to communicate easier and better. And then that affects every cell, every muscle, every tissue in the body, every organ. So our focus is definitely more on the nervous system because it controls and coordinates everything in the body. And if there's I feel like my husband has a great, it's such a guy way of explaining it, but I always love it. He always describes it to a lot of patients as like the spine is like a fuse box, you know, and and it's true. And we kind of access the nervous system that way because it is the core of our body. And when those fuses, when the vertebrae, move out of their normal alignment, it affects the way that nerve communicates to the rest of the body and then back to the brain. So we're really looking at how we can help balance, your parasympathetic and your sympathetic nervous system, which is, our ability to calm, rest, and sleep and have, systems in our body like our periods, like, digestion, things that are very autonomic versus being in fight or flight all the time, which is where a lot of us are. And then they get stuck in that fight or flight, right? And you realize your body can't shift out of it. And that all comes from the nervous system. So yes, our technique is very different as far as how we make the adjustments and how we help balance that nervous system and that mind-body connection. The instrument is just incredible, and it allows us also to, it's easier to work on extremities and knees and shoulders and other parts of the body too. But we see a lot of women that are pregnant. We see a lot of babies and a lot of children. And I love the technique for that too. It's just so much more gentle.
Mhm.
But yeah, then incorporating so many other things that help you heal on a cellular level. That's really our lens for anything that we add to the office, as far as other therapies and other things to add to your wellness routine. Because I truly believe the real benefits of anything are routine, doing it over the course of 10, 20, 30 years. That's when you really get the big benefits. But, things that help you heal and regenerate on a cellular level. So that's why we love PEMF, because that's literally what it's designed to do. And we've seen results in that honestly even surprised us when we brought it in, because I think we've had more feedback from our patients regarding that. On they notice they have better energy, their anxiety is better, their focus is better. Just the neurological aspect of the PMF, it has surprised us. We knew it had that impact, but it's great when you actually see it in
Mhm.
that way, more so than even how it affects the muscle recovery. Or, we knew it'd be great for those things, but sometimes you learn, you're like, oh wow, it's actually really, really great for these
Yeah.
other things that people deal with on a daily basis. Um, Infrared sauna, I mean, I cannot say enough good things about infrared sauna. We have the Sunlightened, which is just our favorite brand. We did a deep dive on, all the different ones out there and the programs that this one has, the frequencies and how that affects, how your body can access those different parts of the body, like detox and lymphatic drainage and, cardio. And I love the frequencies that it uses, and then how it elevates your core temperature and the benefits we get from that is just very different than I think what people thought of sauna before. I was not like a big sauna person, to be honest. I didn't like being dripping in sweat.
Mhm. See, I love it. I'm a big
um,
sauna person.
I was not. I really wasn't until the infrared sauna, and it just definitely it was made me a believer for sure. But the benefits are just, I mean, they're so much deeper as far as a cellular level on that. Certainly massage, acupuncture. We have
Oh yeah, I
Rose,
saw you
who is
guys do
just incredible,
acupuncture
and I
too.
had been. Yes, I had been doing acupuncture for many years, probably about 15 or 17 years. I had seen acupuncturists that I adore here in the Columbus area, that did help me through that hormonal journey too. And so having that here in the office with Rose has just been so impactful for so many of our patients. I think incorporating that into, especially when you are going through hormonal changes and shifts, and it helps the nervous system, calming the nervous system and anxiety. There's just so many great benefits to it.
Yeah.
I know piezo wave is somewhat new, and that is something you have experienced. It is fascinating. And we're one of the few places that have it. We were fortunate to get to trial it from OSU and absolutely loved the equipment. So it was designed originally to break up kidney stones, was what it was being used for. And then they realized it has, some other pretty great benefits. It can break up other things that shouldn't be in the body, like scar tissue and adhesions and things that settle into our joints and musculoskeletal tissue. So the piezo wave has been amazing for people with chronic issues. I feel like when there's chronic inflammatory areas that, you know, old injuries from, sports or whatever it may be, tennis elbow, plantar fasciitis, things that honestly really do impact their life. I mean, it has impacted their ability to be able to go for walks with their family or take vacations or play tennis or play golf or things that bring them joy and keep them active. So it's just blown us away, honestly, the results from the piezo wave and our patients. So that's been pretty incredible because we've just had that this last year. We brought that on in January.
Yeah, and I'm using it for, we call it my right uh, rib stickiness. Is I've just
Yes.
kind of, I don't really know what developed it, but I mean, probably just sitting in the same position. Like, I think it's hard for me to know like what exactly the shift was, whether it was, just natural getting older, like turning into my 30s, or if it was COVID and just shifting to working from home and that just being a change. But regardless, it's been really a nice complement to all the other things that I'm doing and the adjustments too.
Yeah, things like that, they do impact your life and and sometimes our work and our sleep and so I love when we can incorporate very natural things that help the body heal itself.
Yep, totally. So yes, a lot different of a vibe than a chiropractor you might have gone to before, for sure.
Yes, yes. Yes, and we love that. We hope to elevate the whole profession that way. And we have amazing chiropractors, other doctors with us, and it's just inspiring to see them help people in that way and really inspire others to make those lifestyle changes and for their families, for their kids, and that kind of trickles down to generations.
Yep. Yeah, so let's shift gears and talk about my own scan results.
I
Okay.
would love to.
Okay, perfect. All right. So I actually have been seeing you since March because I'm looking at my oldest ones and it's
Yes.
been since March. And I remember that because March was like a rough that was the month I was like, okay, I need to reinvest in my own health. So can you explain, and if you're watching this on YouTube or Spotify, I'm going to share these results on there. Or you can come back to them if you're listening on Apple, or while you're driving or whatnot. But can you explain the first results? Because it was really cool for me to go through this with you. It really confirmed a lot of things that I already knew. And it correlated to my HTMA results, which is the hair tissue mineral analysis that I run on all my clients. I think it's one of the most important labs you can run because it shows a really holistic picture of your mineral status as well as insight into your nervous system and your adrenal function, thyroid function, even your gut health, all in one little hair sample. But I'll get to that. So take it away. You can let me know and let listeners know, like from this scan, what are some highlights of this?
Yes, and I love that you run that because it is such a picture, a snapshot of everything for a person. So it's one of the absolute best ways to look at your true health on so many different levels.
Mhm.
Um, and I think the fact that these correlated with what you had already found and had discovered for yourself and advocated for yourself, it just it's like putting another piece to the whole puzzle, right? And then you see the whole picture then, and then you're like, oh, okay, this makes sense. Because everything is connected. And I think just in healthcare, they, separate things so much and just chase each individual symptom, whereas
Yeah.
our body is all connected. Our nervous system connects with our nutritional level and all of these things. So one of the scans that we run is a surface EMG, and it is looking at on a patient's first visit. And then we do that throughout your care, as you know. So you get to see the comparisons and actually see what's happening internally. But it really shows us, it'll go from basically the very top of your head. So like occiput, C1, very top, all the way down the spine till sacrum, which is right at the base of your spine. And it shows us where the nerve is always firing, right? Like our nerve should be firing at each individual level of each vertebrae. And it'll show us where the nerve is stressed, if it's overfiring or if it's underactive. So it can show if the nerves are overfiring in several areas, it builds stress in the body internally. When there's stress in the nervous system, then when we are exposed to external stress, which that's life, we are all, we're going to be, there's no avoiding stress in life, then our body, if there's internal stress, it cannot adapt and handle external stress. And that's what builds in the body to, then we start seeing symptoms of anxiousness and anxiety and all these, types of, fight or flight all the time because our nervous system just isn't able to release that stress on an internal level. So the scans are just a great way to see, first of all, individually where it's happening in the body. Is that, more L5, L4? Well, then we can also look at where do those nerves innervate? Because yes, you may have pain in that area, you may have back pain, but also those same nerves go to the lower digestive system and they go to the ovaries. So that could be affecting, how you absorb your minerals or how you're processing your food, how, your cycles are able to communicate, the pituitary to the ovaries. So there's so many aspects to that you can get from this one little scan. Um, but then it also shows us a percentage it'll compare the right and the left side. So it'll show us if one muscle is working a lot harder on one side compared to the other. So there's a muscular component as well. So there's a nerve, stress in the nerve component, and then how the muscles are reacting to that stress. So it shows us how your body's compensating, which, a lot of times we can see it in our posture. If we stand in the mirror, and you're getting ready and you're like, oh my gosh, that shoulder is so much higher than the other. You start to see these little things, and that's how our body compensates for those misalignments that are happening internally. Um, and then we can see as, you start getting adjusted, then we do, upcoming scans to see how those things are shifting. If the stress in the nervous system is coming down, and is the balance becoming better in the body. So yeah, so it's a great way to actually see what's happening internally in addition to how you're feeling.
Yeah. And so my scan in March, if you were to give like a snapshot of looking at that, what you see, what would it be?
I would say for your scan, when we really looked at the low back, I think was really what surprised me, even and yourself for your scan, was in the low back, we saw that it was actually underactive. The nervous system was very underactive. And eh, and when we see that, it usually means the problem has been there a very long time. So it's become more chronic. And what happens is when it's been there a really long time, the nerve was probably overfiring for a while, and then it finally just fatigues. And that showed up in your low back, which means it wasn't getting the enough nerve supply to that, the reproductive area, the digestive system. Kidneys are affected, but then also, of course, the muscles are definitely affected as well. Um, So I think that was probably more of a surprise, seeing that in your low back, and it definitely gave us a picture that it had been there for quite some time. And then seeing how much stress was in your mid back area, and even where that rib, that sticky rib is. And that's that sympathetic part of our nervous system, because parasympathetic is basically like at the top, C2, and then down here at L3, L5, and sacrum. Whereas the sympathetic, which is fight or flight, is in the center part of our spine. And that's where you had the most amount of stress and a lot of compensating, as you could see, like around T1, where those muscles were working so much harder on one side compared to the other, which is also very fatiguing to the body. That, it gets tiring. And especially when you're active, you're working out, you're trying to do all these great things that are good for your body. And it's actually creating more stress in the body instead of helping it, be stronger and heal.
Yep. Yeah, and so that correlated to my HTMA results because I'm a fast 2, which means that I am sympathetic dominant, so I'm fight or flight. And I think I mentioned this, but I routinely do labs on myself
Oh, yeah.
because I do different labs than what your doctor is going to run, and I also want labs that my doctor refuses to run. So the HTMA is one of those things where it's a very specialized test. Not all, functional providers know how to read it. And so I've been a fast 2 for the past year. And that's something that I'll be really interested to see what I am the next time I do it here in a couple months. But it's when you're a fast type, it's really hard to change it, at least from my experience, because, and as my lower back shows, it's probably been a chronic issue. And I'm someone who, and maybe you can relate to like your other clients saying this, but it's like, I don't feel stressed until I'm like crying, like I'm just constantly like running on cortisol. Like I'm just a very type A, like driven person that I'm like, if you ask me, like, I don't feel stressed. And I hear that a lot from my clients too. You attract what you are. Um,
Oh, yes.
and so this totally makes sense. And it was really cool to see, even in my physical body, that it was exactly the same as what I saw with my hair tissue mineral analysis too, of being in sympathetic dominance, fight or flight.
Yeah. Yes. Yes. Yeah. All correlates. It's all very much connected. And I think, the more you can help the nervous system in that balance, that mind-body connection, accessing all of those different, areas to all those organs and cells and tissues, then all the other good things that you do just have a bigger impact. Because it does take the other things too. We can't just get adjusted and go eat McDonald's every day.
Yep. Yep. Yeah. And that's again, we take a
Right?
holistic point of view. Like, is nutrition going to solve everything
Yes.
if you're stressed to the max? No. Is chiropractic care going to solve everything if you're eating like shit? No. Like, this is why
Right.
I have people on like you because it takes a village depending on what you need. And I oftentimes refer to people who need additional support in addition to the nutrition
Yes.
root cause work that we're doing.
Absolutely. Absolutely. Yes. And that's why we refer to you too.
Yes.
Because it does take a village. You have to have a team. Really
Yep.
do.
Yeah, you have to have
Yes.
specialists who like that's their specialty and that's their expertise. So what does the EP stress score mean? So it says like with my first scan, 185 was my EP stress score. What does that mean?
So that kind of takes into account the overall picture.
Okay.
When it looks at that stress score, it's looking at not just specific areas, but the overall picture of how much stress is in the body, how much it's affecting your nervous system. Um, so not just related to, the individual areas. So when we look at that, we're kind of looking at the overall electrical activity in and function in the nervous system. And, we like to see that come down. I will be honest, I have several patients that are much higher stress score. I mean, I have been shocked sometimes, but they feel it too. They'll come in and we'll run these scans and they'll have like a 320
Mm,
stress score. And I think, I
wow.
don't know how you're functioning right now. And then they realize they're like, oh my gosh, I finally feel heard and there's a real answer and what I'm feeling is real. And and that's why they feel like they are in tears all the time,
Yeah.
because that stress, that internal stress is just so high.
Yeah. So then looking at my other scans that we took in July. So we did March, April, May, June, July. So about 5 months later. If we look at the snapshot of like about 5 months, my stress score went from in the 180s to the 140s.
Right. Yes. And I think even individually, if when you really start to compare the individual areas, that is also pretty fascinating to see that, okay, you're getting more nerve activity at L5, is improving at the lower part of the spine. T1 was like at 850%, I think, on the right-hand side to begin with. And then it was down to 146. And then a lot less stress in that sympathetic area in particular. Um, and just seeing those changes, and just how it's continually progressing, and then I can't wait to see them in, another 6 months.
Mhm. Yep. Yeah, and this is something where the chiropractic adjustments and piezo and stuff was helpful, and this was a really helpful, you know, almost like check for me of okay, like this confirms that I need to take more care of my, emotional, mental well-being. It's important. My body is feeling this, and this can manifest into other symptoms, like for me it's when I break out, when I'm having acne, like it shows up. That's how my body responds to stress. For other people it's digestive issues. For some people it's really painful or missing periods. Like all of these symptoms are a your body crying for help. But unfortunately, that's where conventional medicine, they're just taught, well, take birth control or take this medication or, put this cream on your face to help with your acne. It's not getting rid of the actual problem. It's just chasing the symptoms versus getting to the root of it, which is what you and I are really passionate about doing, is helping clients get to, well, why is this happening? Why is your nervous system under overfiring? Like, why do you have acne or painful periods? Like, let's figure that out.
Yeah, getting to the root cause is always the key to true longevity, quality of life, health benefits, because, the quick fixes, they just cover things up and the underlying condition is still there and it's
Yep.
going to manifest into something eventually.
Yep.
Yeah.
Or you're going to have to
Yeah.
rely on, a Band-Aid medication for the rest of your life. So if it's birth control, right, and you want to stop and have a family,
Yeah.
or you're realizing it's, negatively impacting your mental health, even though you were put on it, and maybe it helps with, having better periods, you're stuck between a rock and a hard space. So that's where we need to enlist the right support to help you with that.
Yes. Yes. Definitely.
Is there anything else, Dr. Heather, that we didn't touch on or that you want to expand on? Anything else that you think is important for listeners to know about chiropractic, about your approach, anything?
I think the most important thing is not waiting until you're in pain. A lot of people will come once they've already, had a condition, a problem. They've already seen a lot of, specialists or been through the healthcare system. And I think just understanding that it's so much easier to be proactive, and getting adjusted proactively before a problem. You don't have to be in pain to start chiropractic care, especially this style of chiropractic care. But honestly, just across the board, just anytime you're helping the nervous system communicate clearer and help the body heal itself naturally, the way that inborn, it's already inborn, it's already in our gray matter, and we just have to deliver it to our cells and our muscles and our organs. And then all these other great things that, we can be proactive about, like getting the testing done, doing the HTMA testing, don't wait till you have a problem, just really looking at things with a proactive lens instead of waiting until you have a problem or a pain or a condition that then you have to heal.
Yes.
I wish I would have known that, earlier on, before starting a family, and I wish I would have known more to do those things. And now we help patients that, I talk to them about that all the time. Like, hey, it's never too early to start preparing your body for that, and, have it in the best possible, cellular place that it could be in, and just with vibrancy, and that creates a healthier family, and just the overall life, and quality of life, because I think that's really the main key.
Yep. Yeah. No, I'm glad you brought that up because that was something I put on my little outline that I forgot to ask about, or something that I find really helpful is with chiropractic care. I think there's this notion of, oh, well, when I'm hurting, like that's when I go to a chiropractor. But in reality, like you said, it's helpful to be proactive about it. Just like I am very passionate about talking to him about being proactive when it comes to stopping birth control versus stopping. And then you have all these issues like infertility, or, you know, periods from hell, or, all these things. And then you have to
Right.
backtrack, and you know, I think sometimes people have to do that for them to realize, like, oh, shoot, like this was a good learning experience. But if we can get to more people and tell them, hey, like our services are really going to help set you up for long-term success if you do the right things now, so you don't have to go through what you and I went through, I think that can make such a big impact.
Yes. I mean, we see it in, dentistry. You don't wait till your teeth start falling out before you go
Mm,
see a dentist. Or now with skincare, my goodness, I mean, women are doing all these things, right, to prevent aging. And, they're thinking more proactively when it comes to those things, but we need to think that internally as well. And with our hormone balance, with our nervous system, with our joint mobility, we need to think wellness and being proactive in those areas as much as we do about the things that we see.
yes, yes, 1000%.
Yeah.
So, how I always ask my guests, how are you nourishing yourself today, this week, in this season of life?
Today I actually got a massage. So I could
Ooh.
say that was it was the Himalayan salt stone massage, with Jessica. So that was wonderful. Um, and I would say in this phase of life, I mean, most of these things have become very routine for me, which, I can't say enough about, because some phases of life are much more stressful than others. And if you have that as part of your routine, I take certain supplements, and, all of these things, getting outdoor time. But right now, I think, just as far as something I have to make a conscious effort of right now that has been really nourishing, is we have, we're in a very busy phase with our kids' ages as well, because we have 12, 8, and 4. Um, so there's sports, and there's just, plus work and business and all these things. And I think just taking, very conscious, quiet moments with them has been something that's been very nourishing for me. With my husband, like we take these family evening walks because the weather has been so
It
amazing.
has been.
And we're trying to make the most of it while we can. And just taking, even though we know the bedtime rush is crazy, and showers and all these things, but just taking, 10 minutes to all go together on a little walk after dinner has been wonderful.
Mhm.
Um, and just getting, after school, getting them to read for 15 minutes. We sit outside, and, we sit in a tree swing and we read together, and just stealing, even if it's 10 minutes here and there, those little quiet moments with the kids right now.
Yeah, I love that. I think that's important for people to hear too, that it doesn't have to be a whole block of time for it to make a big impact. Like for me, it's recently I've just been going outside and like taking a few deep breaths and then coming inside. And that can be as little as five, like not even like, I mean,
Yes.
a minute.
Yes. Exactly. Yes. Yeah. We'll do this little breathing technique. You know how you have the little app, the Apple Watch little flower for breathing. So I do that with my kids when we're doing bedtime, which is so wonderful. Like it calms their nervous system. It's very, it's a moment for you all to just kind of connect. And I think just little things like that, because in this phase, no, I don't have like a spa day. That's just not, it's not in my
Yeah.
life right now. I wish it was, but it's not. So just being able to steal those kind of moments very consciously and very thoughtfully with your kids and, for yourself, can be very healing.
Yeah. Yeah. Thank you so much for sharing.
Yes.
And just as a little plug, so we just finalized, I'm going to be speaking at Advanced Wellness on October 16th. So if you're a local to Columbus, Ohio, or surrounding areas, we would love to see you there. I think it's $25 or $25, and then you get a
Yes.
$15 credit towards
Correct.
Advanced
Yes.
Wellness. Okay.
Yes.
So if
Yes.
you want to try out any of the fancy stuff she talked about, whether it's an adjustment or infrared sauna, massage, by attending this workshop, and I'll be speaking all about how to October's hormone month. So that's, on par with my brand. So I'm going to be talking about natural ways to heal your hormones and sharing some case studies and how I approach that. So again, if you're local to the area, would love to meet you in real life. And then you can see all of what Advanced Wellness has to offer and connect with other women who are looking to learn the same. So I'll put the link in the show notes for that, as well as your Instagram and your website as well.
Yes. And it's on ours and on our event calendar, which is on our website as well.
Perfect.
We're
Awesome.
excited to have you.
Yay. I'm excited to be there. It'll be so, so good. I'm like a weird person. I love public speaking. So, I mean, that's probably one of the reasons why I like doing podcasts. But
Great.
so, yes, I'm so excited for that. But thank you so much, everyone, for listening. And again, check out Advanced Wellness, Dr. Heather and her team at Advanced Wellness. All the information for their practices in the show notes, as well as that event. And if you haven't yet left a review or subscribed to the show, would really appreciate that. And until next time, stay nourished.
Thank you so much, Taylor.